So here are my notes on how to build a successful chemodenervation clinic using botulinum toxins such as Botox for injecting your patients. I would divide this into three sections. What would you do before seeing your patients for the injections? What would you do on the injection day? And what would you do after the injection day? So let's look at the first segment, before injection day. The first thing you should do is to develop templates and notes. The documentation is highly important in doing a good injection and also for following up on the response to injection and improving your injection results. So you should develop notes and templates. You can find some of the examples on my website, botulinumclinic.com, and on my Facebook page. The next thing you do is a pre-injection visit. The role of pre-injection visit is multifold. You have to first assess the diagnosis and make sure that it's a diagnosis that will respond well to the injections. Two, you have to make sure that you can make a good plan for getting the injection results that the patient need. And three, you should go through specific injection expectation, and I'll talk a little more about it in a minute. You also assign specific role. Who will be providing the supplies? Who will be taking care of the injection vial, making sure that the cold chain is not been broken? Who will be reconstituting the toxin? Who will be setting the patient up, cleaning the patient? And all those roles need to be assigned. You can do all of it by yourself. However, if you want to do multiple injections and run a very efficient clinic, it's sometimes better to assign some of these roles and tasks to other people, such as a technician, an EMG technician, a medical assistant, an MA, or a nurse, or anyone helping you that day. You should also have all your supplies available so that the clinic can run without any hitch, and the supplies can be reviewed separately in a reconstitution clinic video that I've made. You should also set a proper patient expectation, and that's one of the most important key in getting good results with your patient. You have to tell him when the drug is going to kick in terms of benefit. You have to tell him how soon he should see the results, what side effects he may expect, when should be the peak of benefit, how long the toxin would last, how will it wear off, and what would you do in future when it wears off. You have to tell him when he should return for the next injection. You should tell him what side effects to expect. You should also tell him very clearly that there is no fixed dose for this injection, and you're going to make a best guess plan based on your clinical training and previous experiences, and then you will modify based on his response, and you should ask him to make some notes on what the response was like so that you can adopt your injections on the next follow-up. Now, let's look at the injection day. On the day of injection, you should perform the injection based on your previous note, adopt the injection plan to the EMG guidance that you're using or any other guidance that you're using, such as ultrasonography. You should again review the expectation with the patient before doing the injections and during doing the injections and right after it. You should also tell him who to contact for any side effects and who to contact for any failure. A lot of time, the side effects all need hand-holding. We know there's nothing to reverse the side effects of the injection, but if they can call someone and discuss it and review it and be reassured, then that's great. But in the worst case scenario, when they're having side effects that need some acute management, they should know where to go and what to tell the physician taking care of him so that a proper management can happen. You should also schedule the next visit right there. So to continue the continuity of care, that scheduled appointment can be moved to be more flexible based on your vacation, based on patient's schedule, but it should be on the books after the day of injections. So here are a few things that you should think about. After the day of injection, there should be a next dose plan. Most of the time, that plan is based on patient's feedback, so make notes of any phone calls that come in, any side effects the patient had, copy the notes that the patient bring in on the next appointment and adopt the injection plan based on patient response, good or bad. You should also do an audit of your ongoing injection clinics to see how many vials you're using, how many vials you're wasting, how many toxin you're wasting, what's the patient satisfaction and feedback is, what's the revenue coming from that clinic so that we can make sure that the clinic is successful. If you're buying the toxin in bulk, if you're doing enough injections from the company, then you need a strict tab on how much is used and how much is being billed and paid back. You should also have a clear follow-up plan for the patient. Some patients need a scheduled follow-up 4 weeks after the injections, 2 weeks after the injections. Some you can just ask for a phone call. Also depends on your own schedule. And then you can also develop a clear documentation follow up, use a scribe to do your documentation, or use any other such techniques.